as part of efforts to prevent, detect, control and respond to disease outbreaks in Nigeria. The Nigeria Center for Disease Control (NCDC) has organized a Fungal Disease Stakeholders Meeting in the country's capital, Abuja. The event, which had in attendance health experts, laid emphasis on the procedure to combating fungal infections, especially the invasive ones. The Director General, NCDC, Dr. Ifedayo Adetifa, while reiterating the mandate of the body, said they are at the forefront of harnessing available resources to coordinate a national antimicrobial resistant response, just as they are working assiduously to further augment representative surveillance at sentinel sites.
We have in place surveillance for antimicrobial resistance, which the NCDC is responsible for coordinating the national response. What is happening in that respect is that we've got surveillance at sentinel sites, so it's not nationwide. It's representative of regions, but we do not have 100% coverage of the country for antimicrobial resistance surveillance. So it is our next strategy is an area of growth for us, an area for which we are planning to mobilize more resources, both domestic and otherwise, to ensure that we have representative surveillance and can cover all of the citizens we are meant to serve. But I think it's also important to highlight the fact that we do not believe surveillance is separate from the clinical care setting. So the primary investments that national health security builds on really are those that are made in healthcare delivery, because everything in terms of a disease response or whatever starts with identifying the first case. So we have to be able to identify the first case of any illness that presents at primary, secondary or tertiary level of healthcare, and that is not going to be managed by the NCDC out of Abuja. What we can do is to provide support for particular reference sites or regional sites, but we cannot take over diagnosis or laboratory diagnosis of conditions at every level of healthcare.
In the same vein, Dr. Rita Oladili of College of Medicine, University of Lagos, emphasized the importance of timely diagnosis to aid the early detection of invasive fungal infections such as aspergillosis. She noted that for such medical examination, the doctors and laboratory technicians must work in tandem and improve their capacity.
We're looking at things like what we call invasive candidiasis. And from research, it has been shown that if you delay starting treatment for things like invasive candidiasis, invasive aspergillosis, if you delay treatment because you have not been able to make the diagnosis, where every day you delay starting that treatment because of lack of diagnosis, by 20% that patient will die. So you can be rest assured that by the time you do it for 5 days, you miss the diagnosis for 5 days and do not start the treatment, it's invariably that the patient will die. So it's essential that we make this diagnosis early, because the disease can present, it does not carry signboard on its head and say, "Mio and fungal infection." The doctor must suspect it. The lab must have the ability to diagnose it. And currently in country, we have lack in both. The doctors are not suspecting it. The lab does not have the facility to make the diagnosis. So people are dying needlessly. So that's why we got this support to start looking for this disease across the country.
The representative of the World Health Organization at the event insisted that the importance of collaboration and advocacy cannot be overemphasized in the country's quest to combat fungal infections. He therefore called on relevant agencies and partners to synergize.
We need to involve the environmental and those One Health partners, not just for this purpose of lab, but even for advocacy. I mean, you have advocacy as one of the components. So even that awareness level, like this is the meeting, and as a WHO I was in another meeting which is environmental AMR policy launch, and they are inviting us, and we are really happy to be there and to see and supporting, because ultimately the major goal and the mission which we all are working is reducing antimicrobial burden or reducing this AMR by fungal or by bacteria, that doesn't matter.
The Nigeria Center for Disease Control (NCDC) was established in the year 2011 in response to the challenges of public health emergencies and to enhance Nigeria's preparedness and response to epidemics. In Abuja, Nigeria's capital, Abiodun Mohammed, Top Accolade News.